Hello, my well-being buddies. So today we are going to be covering post-traumatic stress disorder, or known as PTSD. So this is quite a complex condition and requires a lot of kind of input. Understanding how it ripples through people's lives is also really important. So let's just start off with what we're going to cover. So what is PTSD? What causes it? Some of the risks, some of the signs, how it's assessed, natural treatments, and then some of the medication in which can be prescribed. So let's just start off with an overview of PTSD. So post-traumatic stress disorder is part of the anxiety family of disorders, and it's caused by stressful situations that could be frightening or distressing events. And what that basically means is within your life, you may have experienced something and it brings it forward into the working memory. And if we think about our brains, and let's just go, we've got our working memory at the front, that's our day memory. And then what happens is it stores. So it stores at night because we go to sleep, our eyes go back and forward and it stores it. And then eventually it goes into our long-term memory. What can happen with trauma and what can happen with PTSD is it's in our working memory and it gets stuck. So it's not processed properly. And therefore, the interventions that we really need for PTSD is proper processing. The problem with PTSD is the fact that it can then trigger all of the other mental health problems. So it can trigger the symptoms of depression. It can trigger anxiety. It can trigger insomnia and nightmares and panic attacks and all of that stuff. So what causes it? Well, the causes can be a serious incident. So, for example, a road traffic incident. It may be an assault, so sexual, muggings, or a robbery. It could be serious health problems, so something that you kind of remember that triggers there. Or it can be through childbirth, so a traumatic childbirth. So there's quite a few things there that can affect this. PTSD can develop disturbing events within days, weeks, months, or years. Ironically, though, you have to have that disturbing event at least 3 months before we can look at some of the therapies that's prescribed for this. PTSD is estimated to affect about 1 in 3 people, so it's a really high prevalence. And the reason it's a high prevalence is this traumatic experience. It's unlikely we're going to get through life without any trauma. So it's about those coping skills, those resilient skills, and managing that trauma. How do we manage it? So ultimately, what we're looking at there then are some of the signs and symptoms. So people with PTSD often revisit that traumatic event. So that could be through nightmares and kind of reliving and playing the scenes through, or it can be through flashbacks. And a flashback is where your mind takes you to something and it feels as if you're there. So it's almost like you can hear things, it's almost you can see things, and it is real to you. And it's very much going on in the now. It obviously can come out in sleeping, so poor sleep, and then the severity is enough to impact your day-to-day functioning. So what then might happen is you start to have avoidance. So if it was a sexual assault, for example, you may not want your partner touching you. If they talk to you in a certain way, that could trigger it. So just being recognised that PTSD can be really life crippling and debilitating. So that's quite an important factor. So people who recently experienced PTSD will have been through those traumatic experiences, such as neglect, abuse, violence, and that's normally part of that diagnosing process for PTSD, hearing that backstory. And I don't want anyone now to be thinking about trauma. I don't want people to go there. That's not the idea of this channel. I will be doing later sessions on how to manage these symptoms, but I don't want you to go there just yet. And often It could be through early life stages as well. So when do we go and get medical advice? So here it's normal to experience upsetting things. It can be confusing, and we should allow our brain a couple of weeks to process, and then up to about 4 weeks after to have this reflection piece to go back. And if you're still revisiting things up to after 4 weeks, then go and speak to your doctor about it, and they may recommend some treatment. So some of the treatment here then is going to be around the symptoms that's coming off the back of this, and we'll talk about that in a second. So firstly, how it's assessed, there are online diagnostic tools. So if you type PTSD assessment tools, you'll come up with a range of them. And ultimately, you're looking for a tool that just does a scaling on that. And if you go to NICE guidelines, the National Institute of Care of Excellence, it will list some tools. But there are some great tools out there. You can key them in and you can get a PDF, and you can take that PDF to your doctor and say, look, I've done my self-assessment. The doctor may decide one of the following things: some watchful waiting. So that's to monitor to see if things get worse. And that's because, again, it is a natural process. What they might do is talk about the insomnia bit, the nightmare bit, and they might prescribe something for sleep. So again, look at my insomnia video. Or alternatively, they might do some sleep hygiene stuff with you, or they could talk about doing some cognitive behavior therapy to help process that trauma. Now, it's important to say that there is a difference between cognitive behavior therapy and trauma-focused cognitive behavior therapy. So TFCBT is there for children and adults, and it focuses on keeping the person safe whilst going through a therapeutic benefit counselling session. What's important in here is that when you attend therapy, you will have a SUD score, which is a subjective unit of distress score. And that SUD score is normally on a scale of 0 to 10. When you leave your session of trauma-focused therapy, or perhaps EMDR, which is the eye movement desensitization and reprocessing, your SUD score should be as low as possible, because what we don't want you to do is leave a therapy session still traumatized. And I hear it time and time again from patients. They went to a counselor, they were asked to talk about the trauma, it re-traumatized them, and therefore it's put them back in a fragile state. So the risks here are very much around, if you are not handling your trauma with the care and attention it deserves, it can come back to bite you. So be mindful of who you're talking to, be mindful about what you open up with, be mindful about what you're sharing, and make sure that when you do share your traumatic experience, you're A, in a safe space, you're B, you're not in a situation where you're time constrained, because if you do dissociate, if you do have a flashback, you're going to need somebody to ground you and bring you back out of that and lower that SUD score down. So how can we do that? How can we lower those SUD scores down, those subjective units of distress? So grounded skills is where we're going to go. You know, let's do a 5, 4, 3, 2, 1. Let's look at 5 things in the room and try and manage it that way. Let's break the concentration. Let's take you out of that loop and try and break that. And that might be throwing a ball or a cushion at you, or just doing something to break that cycle. It might be the case of getting you to have a safety box. And in that safety box could be some of your favorite items. It could be clothes, it could be pictures, it could be a smelling candle. And that's there to re-stimulate your senses and to bring you back into the now, to stop this flashback piece carrying on. It may be the case that you can do some trauma-focused CBT, or alternatively, you can do this EMDR, eye movement desensitization and reprogramming. And with EMDR, the idea of this is, and it's an evidence-based research, it's probably one of the most effective researches for trauma, for post-traumatic stress disorder. It brings the trauma from wherever it's stored, be it in the short-term memory, the long-term memory, the bit of the reptile, or within your working memory, and it just brings it all forward. And then what happens is, whilst you're working with the therapist, the trauma is reprocessed and it's put back to where it needs to be. What it does is it desensitizes that fear, that anxiety, that threat that goes with those images. And that's why it's an anxiety disorder. So the EMDR piece really does help. And equally, I will be doing some videos on EMDR. I'm going to be doing some skills with you all. We're going to be looking at doing safe space. And we'll be doing some things around resourcing yourself. So things that you can do to help yourself. Equally, I'm going to do some guided meditation with you as well, because guided meditation is absolutely brilliant. And I've used it many times in primary healthcare when I was in the surgery setting. And I had lots of patients that would come in and they would be sobbing and crying. We would do some really very simple EMDR processing, and we would do a bit of guided meditation. And at the end of the session, I'd got people laughing, and that distress score had gone from a 10 down to a 0. And it's incredible how quickly it works, and it does work. And as I was told by one of my trainers throughout this when I was being trained in EMDR, you just have to trust it. And it's a weird thing to say, but it does work. Now, on top of that, we have our normal medications if you want to do non-prescribing. So we could be doing our vitamin D, we could be doing our high dose of vitamin B6, we could be looking at those nitols and those supplementary stuff, we could be looking at rescue remedies, we could be looking at lavender on our pillows to help us sleep, we could be looking at sandalwood to re-engage some of our senses. So there's lots of stuff that we can do naturally to manage this. However, it is a complex condition, and therefore you may need to go to your doctor and talk about some medication. And the medication which is normally prescribed are antidepressants. So that's the selective serotonin inhibitor uptakes. And for that, you're looking around things such as sertraline, escitalopram, and paroxetine. You'd be started on the low dose, you would be monitored, you would have your review, and hopefully what would happen is that would help stabilize your mood, reduce some of those night terrors, and pop you back to a great starting place. It's important to say with PTSD, it is about the work that you put in. At the end of the day, you've got to be committed to supporting your own recovery. So that might be keeping things like diaries, tracking your mood, doing your online CPT, doing some of the homework, because again, for trauma-focused therapy, you're going to have homework. The nice thing about EMDR, there's no homework. It's just done in that therapeutic setting. But ultimately, it is going to be the case of you driving this forward for recovery to help yourself. So let's summarize. What is PTSD? PTSD is post-traumatic stress disorder. It comes from traumatic events which comes back to life. And so what can cause it? Trauma. Anything that is shocking, anything that causes you a high level of distress. The risk factors here are around poor choices. It's about dissociating. It can be around that trauma that re-traumatizes you. So when we're talking to people, we have to be trauma-focused, we have to be trauma-focused mindfulness, that we're not getting people to repeat traumatic stories and we're just re-traumatizing them. That's not what we want to do. And if we've only got a short space of time with somebody, we don't want to start something that we can't finish. So don't open Pandora's box if you can't get that SUD score down. Signs are those flashbacks, low moods, irritability, anxiety, panic attacks, touching, all of those things around anxiety, looking at that. How is it assessed? There are online assessment tools that you can use, clinical interviews, but ultimately we are looking for a traumatic event that has triggered this. Natural remedies, looking at around your normal ways of working with vitamins, minerals, healthy diets, low, avoid alcohol and substances, and then that trauma-focused CBT and or EMDR. So I'm obviously advocating here EMDR. And then finally down here, medication. If you do need to end up going on medication or as a combined therapy or using a bit of everything as a stepped approach, then you're probably going to be looking at a low dose of sertraline or escitalopram or paroxetine, which are all prescribed for PTSD. And again, if you go to secondary care, that's what they're going to be prescribing you as well, because that's what's in the NICE guidelines for this. So again, your doctor can prescribe those if you're experienced them. Anyway, I hope you found this video helpful on PTSD. My name's Steve and I'm the mental health nurse. Take care for now.